Ozempic and other weight loss drugs are having a moment. But what are they and how do they work? In this section, we will explain the basics of these medications and their effects on the body. Ozempic is the most famous of a new generation of diabetes drugs that is also used for weight loss. It belongs to a class of drugs called GLP-1 receptor agonists, which mimic a natural hormone that regulates appetite and blood sugar. Ozempic is an injectable drug that is taken once a week. It works by stimulating the pancreas to produce more insulin, which lowers blood sugar levels. It also slows down the digestion of food and reduces the hunger hormone ghrelin, which makes people feel fuller on less food. Other weight loss drugs that are similar to Ozempic include Wegovy, Rybelsus, and Mounjaro. Wegovy is essentially Ozempic marketed for weight loss, and it has been approved by the FDA as the first drug for chronic weight management in adults with obesity or overweight. Rybelsus is an oral formulation of semaglutide, the active ingredient in Ozempic and Wegovy. It is also indicated for type 2 diabetes and has been shown to cause significant weight loss in clinical trials. Mounjaro is a related diabetes medication that combines semaglutide with another GLP-1 receptor agonist called tirzepatide. It causes even more dramatic weight loss than Ozempic or Wegovy, but it is still in development and not yet available on the market. These weight loss drugs are not magic pills that can melt away fat without any effort. They still require lifestyle changes such as eating a healthy diet and exercising regularly. They also have potential side effects such as nausea, vomiting, diarrhea, constipation, low blood sugar, kidney problems, and increased heart rate. They are not suitable for everyone and should only be prescribed by a doctor after a thorough evaluation of the patient's medical history, weight, BMI, and other factors. They are also very expensive and may not be covered by health insurance plans. Ozempic and other weight loss drugs are promising options for people who struggle with obesity or overweight and have not been able to lose weight with other methods. However, they are not a quick fix or a substitute for a healthy lifestyle. They should be used as part of a comprehensive weight management program that includes diet, exercise, and behavioral counseling. Ozempic and other weight loss drugs are not magic pills that will make you slim overnight. They are prescription medications that have benefits and risks, and they are not for everyone. In this section, we will discuss the pros and cons of using these drugs and who can prescribe them. First, let's talk about the benefits. Ozempic and other drugs like it belong to a class of medications called GLP-1 receptor agonists. They work by mimicking a hormone that reduces appetite and increases feelings of fullness. They also help lower blood sugar levels in people with type 2 diabetes. Studies have shown that these drugs can help people lose an average of 10 to 15% of their body weight over a year, which is more than any other weight loss drug on the market. Some people may lose even more, depending on their starting weight and lifestyle factors. These drugs can also improve other health outcomes, such as blood pressure, cholesterol, and cardiovascular risk. They may also reduce the risk of developing type 2 diabetes in people with prediabetes or obesity. Some studies have suggested that these drugs may also have anti-inflammatory and neuroprotective effects, but more research is needed to confirm these benefits. Now, let's talk about the risks. Ozempic and other weight loss drugs are not without side effects. The most common ones are gastrointestinal, such as nausea, vomiting, diarrhea, constipation, and abdominal pain. These side effects tend to be mild to moderate and usually go away over time as the body adjusts to the medication. However, some people may not tolerate these side effects well and may need to stop taking the medication. Other possible side effects include low blood sugar, especially if taken with other diabetes medications, increased heart rate, kidney problems, gallbladder problems, pancreatitis, thyroid tumors, allergic reactions, and injection site reactions. Some of these side effects are rare but serious and may require medical attention. Another risk of using these drugs is that they are not a permanent solution for weight loss. If you stop taking them, you may regain some or all of the weight you lost. Therefore, you need to combine these drugs with a healthy diet and exercise program to maintain your weight loss and prevent weight regain. Finally, let's talk about who can prescribe these drugs. Ozempic and other weight loss drugs are not available over the counter. You need a prescription from a doctor who is qualified to treat obesity or diabetes. Not all doctors are familiar with these drugs or comfortable prescribing them, so you may need to find a specialist who has experience with them. You also need to meet certain criteria to be eligible for these drugs. For example, Ozempic is approved for people with type 2 diabetes who have a body mass index, BMI, of 27 or higher with at least one weight-related condition, such as high blood pressure or high cholesterol, or a BMI of 30 or higher regardless of any other conditions. Wegovy, which is essentially Ozempic marketed for weight loss, has similar criteria but does not require diabetes diagnosis. Before prescribing these drugs, your doctor will review your medical history, perform a physical exam, and order some blood tests to check your kidney function, thyroid function, blood sugar levels, and other parameters. Your doctor will also discuss with you the benefits and risks of using these drugs and help you set realistic expectations and goals for your weight loss journey. Ozempic and other weight loss drugs are not for everyone. They have pros and cons that you need to weigh carefully before deciding to use them. They are also not a substitute for a healthy lifestyle that includes a balanced diet and regular physical activity. If you are interested in trying these drugs, talk to your doctor about whether they are right for you and how to use them safely and effectively. If you want to take one of the buzzy drugs like Ozempic or Wegovy to lose weight, you may face some challenges in getting your health insurance to cover them. These drugs are expensive, and many insurers and employers are reluctant to pay for them. But don't give up hope. There are some tips and strategies you can use to get these drugs covered by your health insurance plan or find alternative options. First, check your plan's formulary, which is a list of drugs that are covered by your plan. You can usually find this information on your insurer's website or by calling customer service. If the drug you want is on the formulary, that means it is covered, but you may still have to pay a copay or coinsurance, which is a percentage of the drug's cost. You may also need prior authorization from your insurer before you can get the drug, which means your doctor has to submit a request explaining why you need it and provide evidence that it is medically necessary. If the drug you want is not on the formulary, or if it is subject to step therapy, which means you have to try other cheaper drugs first before you can get the one you want, you can still try to get it covered by appealing to your insurer. You can ask your doctor to write a letter of medical necessity explaining why the drug is essential for your health and why other alternatives are not suitable for you. You can also provide supporting documents such as your medical records, lab tests, or clinical studies that show the effectiveness and safety of the drug. You may have to go through several levels of appeal before you get a final decision from your insurer. If your appeal is denied, or if you don't have health insurance at all, you may still have some options to get these drugs at a lower cost. You can look for patient assistance programs offered by the drug manufacturers or nonprofit organizations that can help you pay for your medication or provide it for free if you qualify based on your income and other criteria. You can also look for coupons, discounts, or rebates that are available online or through your doctor or pharmacist. You can also compare prices at different pharmacies or online sources and see if you can find a cheaper option. These are some of the tips and strategies on how to get Ozempic and other weight loss drugs covered by your health insurance plan or find alternative options. Remember that these drugs are not magic pills that will make you lose weight without any effort. You still need to follow a healthy diet and exercise regimen to achieve the best results. And always consult with your doctor before starting any new medication or changing your dosage.